Ultrasound is one of the imaging modalities used to diagnose appendicitis. However, it is important to note that ultrasound findings for appendicitis can vary depending on the stage and severity of the condition. Here are some common ultrasound findings associated with appendicitis. Non-compressible appendix. In healthy individuals, the appendix is a small, thin-walled structure that can be compressed or collapsed with gentle pressure. In appendicitis, the inflammation causes the walls of the appendix to become thickened and rigid, resulting in a non-compressible structure. Increased appendix diameter. Appendicitis often leads to an enlarged appendix. The normal diameter of the appendix is typically less than 6 mm. In appendicitis, the diameter may exceed this measurement. Appendiceal wall thickening. The inflammation associated with appendicitis causes thickening of the walls of the appendix. This thickening is often visualized as increased echogenicity, brightness, of the appendix walls on ultrasound. Appendicolith. An appendicolith is a calcified or hardened stool-like material that can obstruct the lumen of the appendix, leading to appendicitis. Ultrasound can sometimes detect this appendicolith as a bright, shadowing object within the inflamed appendix. Periappendiceal fluid. In cases of appendicitis, there may be accumulation of fluid around the appendix, known as periappendiceal fluid. This fluid appears as a hypoechoic, dark area surrounding the appendix. It's important to keep in mind that ultrasound findings alone may not be sufficient to definitively diagnose appendicitis. Other imaging modalities, such as computed tomography, CORT, scan or clinical assessment, may be required for a more accurate diagnosis.